Hi, I'm Aidila. I'll be guiding you the steps to prepare IV Epoprostenol. Before we start, let's make sure you have all the items ready. Now let's begin. First, make sure you are in a clean area.
Choose a smooth, large washable surface to lay out your supplies. Clean the surface with disinfectant wipes. Let the surface air dry. Sanitize your hands with 7 steps hand hygiene. Now, before using, check the expiry dates of all your supplies. Call your care team if they have expired. Do not use them. Open the dressing set carefully by handling the corners and edges only. Open the sterile drape and lay it on the flat surface. Open the syringes, needles, pump cassette and drop them onto the sterile drape. Make sure none of the packaging touches the drape. Flip the cap of the Epoprostenol valve without touching the sterile rubber seal and place them on the drape. Repeat with the saline and lay it flat. Sanitize your hands with rubbing alcohol again.
Now that your hands are clean, do not touch anything including your face or hair. If you have to leave the area or you had accidentally touched something, remember to use rubbing alcohol again before resuming. Now, let's prepare your IV Epoprostenol.
Take the 5 ml syringe and attach the 19G needle to the syringe. Make sure the needle is attached firmly. Remove the needle cover. Pierce the rubber bung of the saline valve with the needle. Make sure the tip of the needle remains in the solution. Draw 5 ml of saline and pull the needle out. Take the Epoprostenol valve and stick the needle into it. Push the plunger in slowly. Keep the needle inside the valve and gently roll both the needle and valve to dissolve the Epoprostenol powder. Do not shake the bottle. Make sure the powder is dissolved and the liquid is clear. Do not use if you see any particles or discoloration. If you do, throw the valve away and start with a new valve again. Once the powder has dissolved, draw 5 ml of Epoprostenol into the syringe. Recap the needle using the scooping technique. Remove the needle from the syringe and discard. Place the syringe on the sterile drape.
If you are using more than one valve, repeat the same steps for all the valves.
Take the 50 ml syringe and attach the 16G needle to the syringe. Remove the needle cover. Pierce the rubber bung of the saline valve with the needle. Draw 45 ml of saline into the syringe and pull the needle out. Recap the needle using the scooping technique. Remove the needle and discard. Place the syringe on the sterile drape. Repeat the steps to prepare another 50 ml saline syringe. On your sterile drape, you should now have a 5 ml Epoprostenol solution, a 45 ml saline, a 50 ml saline, and your cassette. We are ready to fill the cassette. Again, sanitize your hands with rubbing alcohol. First, remove the white cap from the cassette and attach the 45 ml saline to the end of the tube. Screw it on securely. Lift up, then slowly inject all the contents into the cassette. Slide the white clamp to secure the tube. Remove the syringe and discard. Now, repeat the process with the 5 ml Epoprostenol solution. Unclamp the tube. Slide the white clamp to secure the tube. Remove the syringe and discard. Attach the 50 ml saline to the tubing connector. Inject the saline into the cassette. Clamp the tube. Leave the big syringe attached to the tube. For the pump to operate correctly, you have to ensure there is no air bubble in the cassette. To do this, first tilt the cassette like this, so the air or any little bubble will rise up into the corner, and release the remaining air by pressing the safety catch. Pull the plunger on the syringe to suck all the air from the cassette. Do this until you see the liquid fill the tube. Take a final look to check that there are no bubbles left in the cassette. Repeat the process to get rid of the remaining bubbles. Clamp the tube. You can now remove the syringe and discard it. Recap the tubing with the new sterile red cap that is in the package. Be careful not to touch the end.
Congratulations, your Epoprostenol is ready. You can choose to either use the freshly prepared cassette immediately, or you can store it as advised by your care team.
If you intend to store it, remember to label your cassette with the drug name, date and time it was prepared. You can then place the cassette in a sealed box and put it in the fridge.
If you are going to use the cassette now, get ready the following items. Make sure you are in a clean area.
Sanitize your hands with rubbing alcohol. Open up the dressing set carefully and lay it on the flat surface. Open up the extension set. For those who are using stored cassette, verify the medication label. Remove the safety catch from the cassette. To connect the cassette to the pump, fit these hooks into the pivot pins at the base of the pump. Press the pump down firmly so that the cassette fits firmly against the pump. Use a coin and insert into the locking knob. Turn it anti-clockwise until it aligns with the arrow and you can't push further. Give the cassette a gentle tug just to make sure it is connected. Press and hold on-off key for 3 seconds to switch on the power. The pump will now go into a series of tests. Wait till stop appears on screen. Use the next key to check the program set by your care team. Make sure the settings are correct. Ensure you are back at the stop screen. Sanitize your hands with rubbing alcohol again. Thread the tubing through the air detector at the side of the pump and leave a loop. Unscrew the red cap. Take the extension tubing from the extension set and pull out blue cap of the connector. Use the end without the bubble filter to connect to the tubing connector. Release the clamps along the tubing connector and the extension set tubing. Press and hold the prime key until 3 dashes appeared on the screen. Press and hold the prime key again till the word priming appears. Fluid will start flowing into the tube and you will see droplets of fluid at the end of the tube. Release the prime key. Ensure your central venous catheter is clamped. Pull out cap from the purple connector and leave it in the tray. Sanitize your hands again. We may now begin the infusion. Clean your catheter opening with an alcohol swab. Rub 10 times. Connect your connector opening to the purple connector. Unclamp your central venous catheter. Press and hold the stop-start key until dashes and run appear on screen. Your infusion has now started.
Learning how to properly prepare Epoprostenol is an important step in your therapy, and I'm sure your confidence will grow with practice. If you have any questions about your treatment, do approach your care team and they will be glad to assist you. Thank you for watching.